Hello, in this video I will talk about the psychological disturbances observed in neuroimmune diseases such as MOGAD, which stands for myelin oligodendrocyte, glycoprotein antibody-associated disease. The psychological difficulties in MOGAD can often be complex and are often misunderstood. To make it easier to understand, I will explain how these symptoms can develop in two different ways. And finally, we'll delve into the psychophysiological cycle, a pattern many patients describe as an endless loop, to understand where it starts and why breaking it is so challenging. When MOG antibodies attack the myelin sheath and damage specific brain regions, this can result not only in physical symptoms, but also in profound psychological ones. Damage to the frontal lobe may impair decision-making, trigger sudden anger outbursts, or cause noticeable changes in personality. Involvement of the limbic system tends to produce intense anxiety, mood swings, or episodes of depression. When the temporal lobe is affected, memory difficulties and abnormal emotional responses to past events can emerge. Encephalitis, a more severe presentation, can lead to confusion, altered consciousness, and even temporary behavioral changes. Disruptions in the parietal lobe may cause disturbances in body awareness, making a person feel disconnected from their own body or experience shifts in identity. Though this might resemble dissociation, it stems from neurological origins. Impairment of the prefrontal cortex can manifest as a lack of motivation, difficulty planning, inability to concentrate, or hesitation in decision-making. These mimic symptoms of depression, but they are often cognitive rather than emotional in nature. When the basal ganglia and thalamus are involved, emotional regulation may become unstable, resulting in episodes of sudden crying or inappropriate laughter. These are often mistaken for psychiatric issues, but in fact, they are neurologically driven. And with damage to the visual cortex, occipital lobe, visual hallucinations or distortions in perception may appear. Although these may resemble psychotic symptoms, they are actually caused by cortical damage. Now, let's explore the second pathway. How psychological distress in MOGAD can also arise indirectly, shaped by physical symptoms and social factors. In people with MOGAD, some psychological effects don't stem directly from brain damage, but from the emotional burden of physical pain, social challenges, and neuropathic discomfort. Persistent or intense pain in the body can gradually lead to anxiety, depression, sleep disturbances, and even cognitive fog. For example, neuropathic pain in transverse myelitis may feel like stabbing sensations that radiate from the lower back down to the legs. During optic neuritis, sharp eye pain may intensify with eye movement. And sometimes MOGAD itself can cause widespread chronic pain that mimics symptoms of musculoskeletal conditions, such as fibromyalgia, making diagnosis and management more challenging. Over time, these physical burdens can disrupt sleep quality, lower serotonin and melatonin levels, and create a vicious cycle of low mood, increased sensitivity, and social withdrawal. When this cycle isn't interrupted, the person may begin to live a life centered around pain, both physically and mentally. So in this disease, pain is not just a physical symptom. It also challenges mental resilience and affects emotional balance. That's why secondary psychological effects should never be underestimated. In conditions like MOGAD, which are neuroinflammatory by nature, both physiological and psychological effects must be considered together. This disease affects not only the immune system, but also brain chemistry, behavior, and emotional balance. As a result, a physical symptom can gradually lead to psychological deterioration, and psychological stress can, in turn, trigger neurological relapses. The cycle I will now describe summarizes this interrelationship in chronological order based on scientific findings. 1. Chronic stress becomes the trigger. In people diagnosed with MOGAD, uncertainty, risk of physical loss, pain, and social isolation cause chronic stress. This stress disrupts the hypothalamic pituitary adrenal (HPA) axis and affects cortisol balance. At the same time, it increases the release of pro-inflammatory cytokines such as IL-6 and TNF-alpha. 2. Stress-induced neuroinflammation begins. Elevated cytokines activate microglia, leading to brain inflammation. Key regions like the prefrontal cortex, hippocampus, and amygdala are affected, resulting in functional impairments. 3. Cognitive impairments develop. Inflammation impairs attention, memory, and processing speed. In MOGAD-related encephalitis, these effects are even more pronounced. Areas like the hypothalamus, pineal gland, and frontal lobe may be affected, disrupting sleep-wake cycles and melatonin production. 4. Sleep disturbances emerge. Both inflammation and stress disrupt circadian rhythm and sleep quality. Cytokines interfere with sleep onset. Anxiety and mental restlessness reduce deep sleep. Sleep deprivation impairs glial detoxification, further fueling inflammation. 5. Neuropathic pain and fatigue increase. Sleep disturbances lower pain thresholds. Sensitized neural pathways combined with inflammation intensify pain. This creates a self-reinforcing loop of pain, fatigue, insomnia. 6. The cycle reinforces itself. Pain, fatigue, cognitive dysfunction, and insomnia lead to deeper psychological breakdown. This raises stress levels again. Rising stress not only worsens psychological symptoms, but may also trigger disease relapses. And so, the cycle begins again. Unless this cycle is broken, people with MOGAD are forced to fight not only their immune system, but their own minds. That's why psychological support is not a luxury in this illness, but a fundamental necessity. In line with this understanding, we at the MOGAD Solidarity Foundation aim to build a strong bridge between patients, psychologists, and psychiatrists. Our mission is to ensure that no one feels alone and that psychological support becomes an integral part of the healing process.